Have you ever noticed a strange smell on your breath, skin, or even in your sweat, and just brushed it off as nothing? What if I told you that your body might actually be sending you a critical warning sign? It sounds surprising, but science now shows that certain types of cancer can produce distinct odors, subtle but important clues that many people ignore. Your body is an incredible machine, constantly working to keep you alive and healthy. But when something goes wrong, like the development of cancer, it can disrupt your metabolism, triggering chemical changes that affect the way you smell. These aren't just random odors, they are caused by volatile organic compounds, VOCs, released by cancer cells. In today's video, we'll explore 8 distinct cancer-related smells that could serve as life-saving early warnings. Because when it comes to cancer, early detection can make all the difference. Number 1, moldy or rotten wood breath, a hidden warning of mouth and throat cancer. Have you ever talked to someone and noticed an unusual, musty, or moldy smell coming from their breath? Or maybe you've experienced it yourself and chalked it up to something you ate or poor oral hygiene. But what if I told you that a persistent moldy or rotten wood-like breath odor could actually be an early warning sign of mouth or throat cancer? This happens because as cancerous tumors grow in the mouth or throat, they disrupt normal tissue, leading to decay, infections, and the release of volatile organic compounds, VOCs. These VOCs produce a distinct smell, often compared to mold, rotting wood, or even something slightly musty. Unfortunately, many people dismiss this as bad breath caused by food, smoking, or poor dental care. But when it lingers, despite good oral hygiene, it could be a sign that something deeper is going on. Aside from the unusual breath odor, there are other key symptoms to watch for. Persistent hoarseness or a voice that sounds different for no apparent reason can be a red flag. Some people experience difficulty swallowing, dysphagia, feeling like food is getting stuck in their throat. Mouth sores that won't heal, white or red patches inside the mouth, or even unexplained ear pain, which can be referred pain from the throat, are also common warning signs. If you or someone you know has been dealing with these symptoms for more than 2 weeks, it's time to see a doctor. A biopsy, MRI, or CT scan can help detect oral or throat cancer early, when it's most treatable. Don't ignore persistent changes in breath odor or other unusual symptoms. When it comes to cancer, early detection can save lives. Number 2, decomposing odor in stool, a hidden clue to colorectal cancer. Let's be honest, nobody enjoys talking about their bathroom habits. But paying attention to changes in your stool can literally save your life. One of the most overlooked warning signs of colorectal cancer is a strong, persistent decomposing odor in stool, something much worse than usual. It's often described as having a rotting or decaying smell, which lingers even with dietary changes. Why does this happen? As a tumor grows in the colon or rectum, it disrupts the normal digestive process. This leads to incomplete food breakdown, toxin accumulation, and changes in gut bacteria. The body struggles to process nutrients properly, which results in the release of toxic gases and foul-smelling compounds. These changes can make stool smell significantly stronger, even putrid, similar to decomposing food. Aside from the unusual odor, there are several other warning signs to watch for. Blood in the stool is a major red flag. This can appear bright red, dark, or even black and tar-like. If you've been dealing with persistent abdominal pain, cramping, or bloating, it could be a sign that something is obstructing your intestines. Unexplained weight loss or sudden changes in bowel habits, like long-term constipation or diarrhea, should never be ignored. If you've noticed consistent changes in stool odor and any of these symptoms, it's crucial to get checked by a doctor. A colonoscopy or stool analysis can detect abnormalities in the colon before cancer spreads. The good news? Colorectal cancer is highly treatable when caught early. So don't dismiss what your body is telling you. If something smells off, it's time to take action. Number 3, sweet, unpleasant skin odor, a hidden clue to breast cancer. Most people associate breast cancer with a lump, but did you know that changes in skin odor can also be an early warning sign? A sweet, sickly, or slightly foul odor coming from the breast area is something many overlook, but it could be a sign of an underlying issue, especially in more advanced cases of breast cancer. As breast cancer progresses, it can lead to ulcers, infections, and tissue necrosis, cell death, in the affected area. When cells die, they release volatile organic compounds, VOCs, that create a sweet but unpleasant odor, sometimes described as a mix of decay and infection. In some cases, open sores or wounds on the breast may also develop, making the smell more noticeable. Many people mistakenly attribute this odor to poor hygiene or minor infections, delaying crucial medical attention. Apart from the unusual odor, there are several other warning signs of breast cancer. The most well-known is a lump in the breast or armpit, but subtle changes in the skin's texture, such as dimpling, redness, or puckering, can also indicate trouble. Nipple discharge, especially bloody or milky fluids, is another concerning symptom, as is persistent pain in the breast that doesn't go away. If you notice any combination of these symptoms, don't ignore them. A mammogram, ultrasound, or biopsy can help detect breast cancer in its early stages, when treatment is most effective. Your body communicates in many ways, including changes in odor. If something smells off, take it seriously and consult a doctor. Early detection could save your life. Number 4, sulfur or rotten egg breath, a hidden clue to stomach cancer. Bad breath is common, but what if yours smells like sulfur or rotten eggs, even after brushing, flossing, or using mouthwash? If this persistent foul odor is combined with digestive discomfort, it could be a warning sign of stomach cancer. While most people blame bad breath on diet, acid reflux, or poor oral hygiene, a lingering sulfuric smell may indicate a more serious underlying issue. Stomach cancer disrupts digestion, altering the way your body breaks down food. As a result, bacteria overgrow in the digestive tract, leading to an excess production of hydrogen sulfide gas, the same gas responsible for the smell of rotten eggs. Unlike occasional bad breath, this odor doesn't go away even with improved oral hygiene, breath fresheners, or dietary changes. Apart from this persistent sulfur-like breath, stomach cancer often comes with other digestive red flags. Many patients experience frequent nausea, bloating, and loss of appetite, sometimes feeling full even after eating small portions. Persistent indigestion or heartburn, especially if it worsens over time, can also be a sign that the stomach lining is affected. More concerning symptoms include unexplained vomiting or blood in the stool, which may appear dark, tar-like, or coffee ground-like in texture. If you notice these symptoms along with a sulfur-smelling breath that won't go away, it's essential to see a doctor immediately. A gastroscopy, endoscopy, and imaging tests like CT scans can help detect stomach cancer early, improving the chances of successful treatment. The bottom line is your breath can reveal more than just what you ate. If it consistently smells off, don't ignore it. Early detection saves lives. Number 5, rotten meat smell, a warning sign of advanced skin cancer. Have you ever noticed a foul, rotting meat-like odor coming from a skin lesion or wound? While most people associate skin cancer with changes in moles or new growths, few realize that a persistent bad smell can also be a red flag, especially in more advanced cases. As skin cancer progresses, particularly melanoma or aggressive non-melanoma types, cancer cells multiply uncontrollably, damaging healthy tissue. Over time, the tumor can outgrow its blood supply, leading to necrosis, tissue death. When skin cells die, they release volatile organic compounds, VOCs, which cause a strong, putrid odor similar to decaying flesh. Additionally, ulcerated tumors can become infected, intensifying the smell. Many people mistake this for a minor skin infection or poor hygiene, delaying urgent medical attention. Apart from the distinct rotten odor, there are other crucial warning signs of skin cancer. A mole or dark spot that changes in size, shape, or color should always be checked by a dermatologist. Sores or ulcers that won't heal, even after weeks, are another serious concern. If a skin lesion becomes itchy, starts to bleed, crust over, or ooze, it's time to take action. Many people assume these changes are harmless, but any persistent skin abnormality should be examined by a professional. If you notice a suspicious spot, lesion, or wound with a foul odor, don't wait. A dermatologist can perform a skin biopsy to determine if it's cancerous. Melanoma is one of the deadliest skin cancers, but early detection significantly increases survival rates. Listen to your body. If something smells off, it's time to see a doctor. Your skin's health could depend on it. Number 6. Ammonia-smelling urine, a silent warning of kidney cancer. Most people don't think twice about how their urine smells, but if you notice a strong, persistent ammonia-like odor, it could be more than just dehydration or diet-related changes. In some cases, this could be an early warning sign of kidney cancer, a disease that often develops without noticeable symptoms until it reaches an advanced stage. The kidneys play a crucial role in filtering waste and toxins from the bloodstream. When cancer disrupts kidney function, excess urea and other chemical byproducts build up in the body. This leads to urine that smells strongly of ammonia, even if you're well hydrated. The odor may be more noticeable in concentrated urine and can persist despite drinking plenty of fluids. But changes in urine smell alone aren't enough to diagnose kidney cancer. There are other key warning signs to watch for. Blood in the urine, hematuria, is one of the most serious symptoms, appearing as pink, red, or brownish-colored urine. Many people dismiss it as a minor issue, but even a small amount of blood should be checked by a doctor. Another red flag is persistent lower back pain, often felt on one side, near the kidney region. This is not muscle pain, it tends to be deep, dull, and unrelenting. Additionally, symptoms like chronic fatigue and unexplained weight loss could indicate that cancer is affecting overall body function. If you experience ammonia-smelling urine along with any of these symptoms, don't ignore it. An ultrasound, MRI, and urine tests can help detect kidney cancer early. The sooner it's caught, the better the chances of successful treatment. Your body gives you clues, listen to them before it's too late. Number 7. Metallic smell in breath and sweat, a hidden clue to blood cancer. Have you ever caught a strange metallic or rusty smell in your breath or sweat and wondered where it was coming from? Most people dismiss it as diet-related, but if this smell is persistent and unexplained, it could be an early sign of blood cancer, such as leukemia or lymphoma. While this might sound surprising, it all comes down to how cancer affects the body's chemistry. Blood cancers disrupt normal blood cell production, throwing off the balance of iron and other minerals in the bloodstream. This change leads to the release of volatile organic compounds, VOCs, which can create a metallic odor, similar to rusty iron or old coins. This smell may be especially noticeable in sweat, breath, or even from the skin after light physical activity. Some patients describe it as the taste of metal in their mouth, even when they haven't eaten anything metallic. Beyond the unusual smell, other key symptoms of blood cancer should not be ignored. Extreme fatigue is one of the most common signs, as cancer disrupts the body's ability to produce healthy red blood cells, leading to persistent weakness and exhaustion. Many people with leukemia or lymphoma experience frequent infections due to a weakened immune system. Another red flag is easy bruising or unexplained bleeding, even from minor bumps. If you notice a persistent fever, night sweats, or significant, unexplained weight loss, these could be signs of an underlying blood disorder. If you experience a metallic odor along with any of these symptoms, don't ignore it. A blood test and bone marrow biopsy can help diagnose leukemia or lymphoma early, improving the chances of effective treatment. Your body sends signals, listen to them and take action before it's too late. Number 8. Sweet, fruity breath, a hidden warning sign of lung cancer. Have you ever noticed a persistent, sweet, fruity odor on someone's breath, even when they haven't eaten anything sugary? Most people associate breath odor with diet, dental hygiene, or diabetes, but a lingering, unexplained sweet smell could be an early warning sign of lung cancer. While it may seem harmless, this odor is caused by serious metabolic changes happening inside the body. Lung cancer alters the way the body processes chemicals, leading to the release of volatile organic compounds, VOCs. These compounds accumulate in the lungs and are then exhaled through breath, creating a fermented or slightly fruity odor. Unlike bad breath caused by bacteria or digestive issues, this smell doesn't go away with oral hygiene and may become more noticeable over time. Beyond changes in breath odor, lung cancer often presents with other warning signs. A chronic cough that won't go away, especially if it worsens over time, should never be ignored. Wheezing, persistent shortness of breath, or a tight feeling in the chest could indicate that a tumor is affecting airflow. Hoarseness or voice changes may also develop, along with chest pain that worsens with deep breathing, coughing, or laughing. In more advanced cases, symptoms like unexplained weight loss, fatigue, and coughing up blood may appear. If you or someone you know has persistent fruity breath along with these symptoms, it's crucial to get checked by a doctor. A chest X-ray, CT scan, and lung function tests can help detect lung cancer early, when treatment is most effective. Your breath might be telling you something important. Pay attention and act before it's too late. Your body has a way of warning you when something isn't right, and sometimes those warnings come in the form of subtle but unusual odors. While these smells may seem insignificant, they could be early clues to serious illnesses like cancer. Recognizing them early could mean the difference between life and death. If you've noticed persistent, unexplained changes in body odor, breath, urine, or sweat, don't ignore them. Consult a doctor immediately. Early detection is key to increasing survival rates and improving treatment outcomes. Stay informed and help others do the same. Share this knowledge with your friends and family. It could save a life. And if you found this information helpful, like, comment, and subscribe for more life-saving health tips. Your health matters. Listen to your body.